Hello, today we will be discussing on how to position our patient for a PA skull or Caldwell. First, we will need to do our patient preparation. We will need to introduce ourselves when we go get the patient from the waiting room, state that we are going to be taking their images, and ask our patient for their full name and date of birth, while simultaneously checking their wristband to ensure we have the right patient. We will also need to ask our patient when was their last menstrual period if needed. The image receptor size for this image should be a 10 by 12 cassette or a 24 by 30 centimeter cassette. The image receptor orientation should be portrait. The image receptor location can be the wall bucky or the table bucky depending on where our patient is most comfortable. Usually it should be done at the wall bucky to ensure easier movement. The SID for this image should be approximately 40 inches or 100 centimeters. The patient positioning for this patient is that we will need to have our patient erect at the wall bucky or sitting down depending on the height of the patient. We can also have the patient prone on the table bucky if needed we, to do this image. We will need to remove all metallic and plastic objects from around the head and or neck area to ensure we don't have any artifacts within the image. Our patient our part position for this image should be that our patient's nose and forehead should be against the wall bucky or the table bucky. We will need to flex their neck as needed to align our OML perpendicular to the IR. We will also need to align the MSP perpendicular to the IR to prevent rotation and or tilt and center the image receptor to the central ray. The central ray location should be center and exit at the nasion. We will also need to do a angulation of 15 degrees caudal for our angulation for our central ray. The collimation field size for this image should be open collimation with about 1 inch of collimation on each side of the ear and about 1 inch above the vertex to ensure no clipping of the top of the head. Our visual of appropriate marker location should be on either side of the head so long as it is on the correct side and in the lower part closest to the mandible. Our KVP range for this image should be about 75 to 85 kVp. Our instructions for the image should be that we will need to instruct our patients to stay still and not move. We will be exposing on suspended respiration, which we will need to tell our patients to not stop breathing and not to move while we expose. The anatomy demonstrated in this image should be that we will need to see the petrous ridges in the lower thirds, the frontal bones, and the maxillary sinuses. Items in profile for this image should be the different sutures of the skull, petrous ridges, and different margins in the skull as well. Pathology best demonstrated in this image should be skull fractures and neoplastic processes, as well as Paget disease. That is everything we need to do in order to position our patient for a PA Caldwell.